Leading by example, Prime Minister Alan Chastanet on Wednesday received his first jab of the Astra-zeneca vaccine. The Prime Minister was joined by his wife, Raquel Chastanet, who also received her first dose of the vaccine. The much-anticipated rollout of the first phase of the inoculation programs took place at the Finance Administrative Center and was live-streamed to viewers. Prime Minister Alan Chastanet, following his primary dosage of the AstraZeneca COVID-19 vaccine, spoke to NTN host Lisa Joseph and President of the SLMDA, Dr. Merle Clark, about the landmark undertaking.
I also want to thank the government of India. The OECS and some of the CARICOM countries have been in discussions with the government of India for some time, and I'm so grateful to them for making these vaccines available. I also want to thank Barbados and Dominica, who received those vaccines earlier, to sharing some of them, given what our current situation is, being able to vaccinate our frontliners, our key people right now, because nurses and doctors are irreplaceable. Firemen and ambulance drivers and our policemen are irreplaceable. These are not things where you can just go and find somebody else to be able to replace them with. So the experience that they have, the teaching and the education that they have, these are not easily replaceable. So being able to come out and protect them right now is also a way of protecting all solutions.
The efforts of the SLMDA did not go unnoticed, as Chastanet stated his appreciation for private physicians who made themselves available during challenging times with the uptick in numbers following the Christmas holidays. The Prime Minister also applauded the national effort at controlling the spread of the third wave of the virus.
I'm also very excited because the 3,000 vaccines that we've received is just the beginning. So we are receiving an additional dosage of about 25 to 40,000 from the Indian government as a grant, and we're getting another 77,000 from COVAX, which is through a UN organization, and we are actively pursuing the purchase of the remaining 180,000. And I think that we're getting close, that we'll be able to announce something very soon. But certainly I think that what we've achieved so far is putting us absolutely on the right track and giving people a substantial amount of hope. But I'm certainly hoping that that hope doesn't cause people to let down their guard.
Minister for Health Mary Isaac soldiered through her first shot of the vaccine as well. She noted the privilege of the frontliners and government officials, as highlighted by the growing interest by many to secure their first jab.
There are lots of people who want to come in. So it is quite a relief to know that we have the vaccine, and hopefully the vaccine is going to provide us additional protection, like we see it rolling out in some other larger countries, and the numbers are going down. So we are very hopeful that this is going to happen here as well, and that people will, present themselves to take the vaccine.
What of the vaccine itself? How did the Minister for Health feel after her first jab?
I feel great. I didn't feel a thing. The nurse was so gentle.
Right.
I didn't even feel like you normally take an injection and you feel a little sting.
Something.
Nothing at all.
Something.
So it's quite something,
All right.
No difference at all.
The nurses here, I think Nurse Sunshine Edward, I see Nurse Butcher, I see Nurse Regis over there. Who else we have here? Yes, so those are the angels administering those vaccines.
Yes.
That really nobody is feeling anything.
Right, and they are doing a great job.
They're doing a great job.
So far.
Our nursing staff appreciation really has to be shown for the fight that they've put up through this COVID-19 journey and even before. And
we are here now, and it's a relief for them as well to see that, this vaccine is here and is going to help, hopefully, ease up the burden a bit. So we are seeing that it's rolling out, and it's quite exciting to be here.
Indeed.
And it's no fuss at all. It's no big deal.
The WHO has recommended priority be given to healthcare workers and people over 65 years, given the limited supplies of vaccines. Vaccines are recommended for persons with comorbidities that are at risk of severe COVID-19, including obesity, cardiovascular disease, diabetes, respiratory ailments, and persons living with HIV. The vaccine is not recommended for persons younger than 18 years of age, pending further studies. The Astra-zeneca vaccine is delivered in 2 doses with an interval of 8 to 12 weeks. Solange Alfred, HTS News Force.